for a while, then a walker, but is the first in Texas to try a new therapy that has him back on his feet again. Jack Pennington can't believe he's walking again. Many doctors told him that was a pipe dream after he was seriously injured in a car accident and underwent double knee replacements in 2008. He got an infection then that lay dormant for a decade, but came back in 2019 out of nowhere.
I'm not a diabetic or anything. I worked out 5 days a week. I eat pretty healthy. I don't drink. I don't smoke.
It just
so
came back.
just came back. I woke up one day and my leg was the size of a basketball. It was just unbelievable.
Jack has undergone 15 surgeries in the past 4 years alone in an attempt to save his knees.
You're able to walk again?
Yep.
Then he started seeing Dr. Encore Mehta with TX Spine and Joint in Houston. The specialist shared hopeful advice and encouraged him to try a treatment that straps onto his legs.
So this is considered electrical stimulating device. Basically, it has these electrode pads that can send electrical current through your skin. And when the pads stimulate the muscle by sending electricity through, it causes the muscle to contract. Just like I'm sure you've seen those six-pack ab devices, similar to that.
Dr. Mehta says it contracts and works out muscles, even while a patient is sitting still. It also has a high-tech microprocessor with a gyroscope built into it.
The gyroscope can evaluate what part of the gait cycle they're in. And based on that, it tells the quadriceps to contract so that the leg can be lifted out of the way to have a proper swing through gait.
Jack says in the beginning he didn't believe it would help, but then the first sign it did changed everything.
I was able to get my leg in the car without grabbing it with my hand. I said, oh my goodness, so something must be working. And then I've transitioned to a cane. I mean, I can't walk long distances with it yet, but at least I can get off the walker and walk with a cane. Gives me a lot more confidence, makes me feel better.
So the Bioventus L360 device, we were able to use that to essentially recover the atrophied muscle, because once the nerve dies to a muscle or the muscle shrinks beyond a certain level, it's very difficult to rehab it to the pre-injury or pre-sickness level. And in our field of physical medicine, rehab, and pain medicine, our goal is to get him back all the way to full function. And this particular device was able to stimulate the quadricep muscle to such a degree that he was able to regain the function.
And the minute you strap them on, you feel like you need to go do something, and it's been working. I've been walking somewhere in the neighborhood of an hour to 2 hours every day, 5 days a week.
So I heard the good news, you're able to walk again?
Yep, I appreciate you getting these for me.
Dr. Mehta believes this device is a step closer to even more greatness for people with mobility issues.
I would not be surprised if within the next 10 years there's substantial headway to the point that patients are able to regain ambulation.
That's great. I mean, I couldn't do this before.
Jack says it has helped him and his wife regain their quality of life.
It's been excellent for us. I mean, it's changed our life because I was pretty discouraged. We've been married for 42 years. So.
It's really a gratifying, very gratifying thing to see him back in action.
I love that. He's doing so well. So join me at 12:30 online today for Lunch for the Soul. Jack will share more about his exciting journey to mobility. You can find us at fox26houston.com or our YouTube page.
Awesome. Is there something he's looking forward to doing now?
Travel. He said he can't, and just going to a restaurant with his wife, because he said before it was so hard to come in and out, and he felt like people were staring, and now it's just easy for him.
That's awesome. Wishing them the best. All right, let's check in again with Mike to find out the timing